am here with Aimee Rossini, a wellness coach with us here today. How are you, Aimee? How are you?
I am doing great. Obviously, slight eye issues today. My daughter has given me pink eye. So,
Oh, she had. Look at you. Look at now. Listen, this is a testament to true entrepreneurship because you still showed up, didn't you?
yes, absolutely. Yeah, no, I've already talked to my doctor today and I'm like, I need some eye drops, please.
Oh my goodness! Well,
yeah,
welcome. Thank
so
you so much for continuing to, spend your time here with us today. I'm excited to learn more about your coaching business.
absolutely, for sure. Thanks for
Yeah,
having me.
absolutely. So, tell us a little bit about your business and your background, and how you ended up segueing from your original career path, being a physical therapist, to kind of pivoting and going into wellness coaching.
Right. So I started my business back in June. So it is still very, very new and still in the process of kind of getting the whole thing off the ground. And um, I actually, the program is set to start in January. So um, in the process of, I've been a physical therapist now for a little over 11 years.
Mm-hmm.
And over the course of that time, I've, worked in a variety of different settings, but I've been in the home health industry for about the last 7 or so.
Mm-hmm.
And it's just kind of been, I think it's really just been a long time coming sort of thing. It's been, patients coming home from the hospital and they're sicker and sicker when they're getting home, and they're getting kicked out of the hospital a lot faster these days compared to what they used to. And so they're
Yeah.
just a lot higher acuity. And the majority of them have like no idea what happened when they were in the hospital. They maybe know some details, like why they went in the first place. But other than that, there's a lot of times where they really don't have a clue, kind of what was done or what the results were really. They're home and they still feel like crap. And
Yeah.
so, and they just don't know. And so actually, I think the straw that broke the camel's back for me was a lady that I went in to do an evaluation with, and she'd been diagnosed with Parkinson's a few years ago. And I sat with her talking to her about the Parkinson's, and she tells me that she's been diagnosed for about 2 years at that point. And I'm like, okay, no problem. And I'm, kind of going on doing my thing. And she asks me, what is Parkinson's? And I'm like, wait, what? Excuse me?
Yeah.
So she has gone 2 years into her diagnosis, which Parkinson's is one of those things which you have it for a long time, a lot of the time before you actually even get your diagnosis. So she's been dealing with it for more than 2 years.
Oh,
And
wow. Okay.
nobody had taken the time to really sit down and even explain it to her, what it means and what it's going to look like for her life moving forward, what she can do to combat that, and what it
Yeah.
even meant to have Parkinson's. And so I
Right.
ended up spending the next about 30 minutes or so explaining to her in layman's terms, what is Parkinson's, what is it doing to you, and kind of what she could be expecting kind of moving forward, and the things that she could start doing to try to, get past it. Because Parkinson's is, a progressive disorder. You're not going to cure it, but there are things that you can do to live with it and to keep it from determining your life. And you can be in charge rather than the disease process, for sure.
Well, I
And
love
here we are.
your wellness, your journey to becoming a wellness coach was based on the foundation of wanting to slow things down for your patients, right? Wanting to take a little time, not have an expectation of them to know what it is that you're talking about. So someone could say
Exactly.
you have Parkinson's and they expected her to receive that and know all of the symptoms, know what that means, break it down. And she probably didn't even feel comfortable enough to say, I don't know what that means.
Right.
Could you help
Well,
me
and most people, they go to the doctor and they spew out all this medical jargon, and the way insurance and Medicare has changed the healthcare system in the last few years, documentation has just gotten outrageous. And, so most practitioners, no matter who you're going to, whether it's in home health or in a doctor's office or whoever, most of us have our nose in a computer for the most part of your visit,
Yeah.
and, we simply don't have the time a lot of the time to sit there and give that in-depth explanation so that you do understand and give you the opportunity to ask the questions you need to ask
Yeah.
and have things explained to you in a manner that you can actually understand. So it makes a pretty huge difference for people.
So did you make the change because you could appreciate by shifting a little bit and becoming a wellness coach that you would essentially be helping the entire person rather than a localized issue that typically, you know what I mean?
Yes,
It
exactly.
feels
Yeah,
a little
no,
bit more all inclusive with the wellness coaching.
sure. So my program, my business is called Camp Health and Wellness, and diseases to transform their health management, maximize their quality of life, and less energy on medical care. And it is a 12-week program. And we focus on 3 pillars, which would be health literacy. So actually understanding your and intuitive lifestyle choices, knowing what choices to make and what the choices you are making, how those are going to affect you. And, in addition to all of that, summing it up with, that long-term implementation, being able to carry it forward and know what to do and how to do it moving forward so that you're able to continue to manage your condition.
It's more
because for the most part,
go ahead. Yeah.
Yeah, right. So for the most part, like 95 to 99% of decisions, medical decisions for chronic conditions are made by the patient with almost no input. So, you go to the doctor and you're getting your input from them and you're taking your medications or whatever you're doing. But when it comes down to, do I need to make an appointment? Do I want to take that medication? What am I going to eat today? What kind of stress am I having in my life? All of those things, those are decisions that you're making every second of your life, right? How you're living. All of that goes into managing your chronic condition and what the outcomes are going to be and how that disease process ends up progressing.
Do you have a specific target market? Is it more seasoned people? I don't like to say old. I think it's disrespectful.
Well, you're not old until you're 85, unless you're my dad. So no. Generally speaking, I'm work with anybody with a chronic conditions. It really doesn't matter how old you are, because there are people who are in their 30s and have type 2 diabetes, and there are people who are in their 70s and have Parkinson's. You know what I mean? So it really doesn't matter. Generally speaking, I would say that the majority of people I work with probably are like 50 plus, but yeah, that's not an age requirement. It just is completely dependent on your medical issues.
Where you are. Right.
Yeah.
So, well, first off, congratulations on taking the leap, making that transition into becoming a wellness coach. What is some advice that you would have for another person that is interested in taking a leap of faith and getting into entrepreneurship? What prompted you to pull the trigger?
I think that for me, honestly, a lot of it was actually work-life balance, and in working as a physical therapist, the demands on how many patients to see and, all of that, actually, it has just exponentially increased with, especially since COVID, because so many people have so many more issues now than they used to, or that they are exacerbated now because of the effects of COVID or the vaccinations or whatever. And, a lot of people, attribute some heart issues that they have now, or, obviously lung issues that they have now that they maybe didn't have before COVID. And they attribute all those things there. And so, while a lot of people got sick and a lot of people died, but a lot of people survived, and now they're dealing with all the repercussions of all of those things. And, so as far as, taking that leap, I would just say consistency is the biggest thing. You have to be there for people. And if you're not willing to be there for people, then you might as well not bother.
You have to care.
Right.
Right.
You have to care.
We're all called to do different things. I love that you're called for health, and so many of our other guests are just called for all these various things, insurance and real estate and just
Right.
art, creating. It doesn't matter what you're called to do, but you have to care. Like that
You
has to
have to care.
be fundamental foundation of everything that we do, and showing up for people when you say that you're going to. That's amazing. Now, I want to kind of touch on what you just said, that you have seen a spike in your clientele due to COVID, and directly in relation to the vaccination. I can't think of the word. I want to say innovation, but no, the immunization shots.
Yes. There are
Really?
a lot of people that I have talked to that, whether it's, fact or not, they have decided in their brains at least that some of the medical issues that they are now experiencing, they are attributing to latent effects from the vaccinations or from having COVID as well.
Wow. That's
a lot of
incredible.
cardiac issues and a lot of weird things too that I just agreed with, but
Wow. Well,
but yeah, a lot of cardiac issues. So
yeah. Oh, that's incredible. So, as you are building your business, what do you hold in your mind as success? What does that look like to you?
just being able to help people move through their medical conditions easier so that they're not constantly in the revolving door of the doctor's office. And, as our generation, as the population ages, and we've got the baby boomer population coming into those senior years at this point, and so that's a lot of people they're going to be flooding those healthcare systems, and to be able to better self-direct so that you know what to do, and maybe you can even prevent some of those doctor's appointments that would be needed in the future, so that you're able to make the right choices on a day-to-day basis that are going to promote an optimal outcome and an optimal well-being, and slow the progression of that disease process, and even support combating the disease process. I mean, for example, if you're not doing the right nutrition and the right amount of physical activity, you can get off diabetic medications. Type 2 diabetes is technically not curable, but you can kind of cure it using diet and physical activity. And if you're doing, eating the right stuff and you're doing the right amount of physical activity, you can lower your numbers, kind of like what Travis was talking about with the A1C numbers. If you can lower those numbers down to where maybe you're no longer symptomatic, and you can continue those lifestyle choices that help you be able to stay off of those medications.
I think it's
every single medication there is has a million long list of side effects. So
that's the truth too. I think it's amazing how people that are pre-diabetic or have been diagnosed with diabetes change their nutrition and their habits and their exercise routine. It may have been non-existent at some point, and then they change those patterns, and now the symptoms of diabetes have completely been eradicated. And there's such defensiveness around that language of, oh, once you're a diabetic, you're always a diabetic. Like, I've seen arguments on panels, like medical doctors that are advocating for you to continue to wear that label that you are a diabetic. You will be a diabetic until you die, but you don't have the symptoms anymore. They have been completely reversed with diet and nutrition and exercise.
That's exactly right. Unfortunately, from a medical standpoint, that diagnosis is probably going to follow you around for the rest of your life. It's in your chart, and there it sits. Once it's there, it's there. But it doesn't matter what's on that piece of paper. It matters what you're doing in your everyday daily life and how it's actually affecting you and what you are having to live with. And if you are doing the things that you need to do, diet-wise, exercise-wise, stress management-wise, all these list of things on a daily basis, it doesn't matter what that piece of paper says, because you're living better and you're going to be happier and feel better and be able to enjoy life. And so it really doesn't matter that it still sits on that piece of paper.
I want to put a pin in that. We're going to be back in 29 seconds, but I want to touch on the stress management piece too, because we talk about that. So guys, don't go anywhere. We'll be right back in 29 seconds. Okay, and we're back. So Aimee, we oftentimes hear about the importance of diet and exercise. Those are kind of our go-to in the wellness space. But let's touch on stress management and how that comes into play as well. So what is your advice and your something that you typically see on how that affects someone's holistic well-being with how they manage stress?
Oh, absolutely. So, I mean, like anybody listening, raise your hand. Who doesn't have stress? I don't see a single hand, right? No, every single person in this room, everybody on this show, everybody has some kind of stress.
Yeah.
You know, and so it's just something that affects everybody. And, you know, what your specific stressors are going to be maybe different from what the next person's stressors are. But everybody has stress, and dealing with that stress has a significant impact on your well-being. So, you know, prolonged exposure to chronic stress hormones in your body ends up majorly impacting a variety of different body systems. And it increases how much fat tissue you're going to have. It ends up affecting your mental health. And, you know, a lot of people, when they're stressed or they're anxious or they're depressed, they turn to food and they eat comfort food, right? And you sit there, eat a bag of potato chips. Okay, well, that just feeds right on into all those other things, clogging your arteries with all that cholesterol or increasing your blood sugar, or, you know, it just makes a huge difference. And if you are able to manage stress better and do self-relaxation techniques and really actually do some self-care activities, it makes a huge difference on, I mean, even just how you feel from a day-to-day basis and what your outlook on life is like. And, you know, what your mindset is going to be, you know, moving forward. So imagine, you know, that everything is great. You've just gone through, had a massage and done some meditation, and you are like super relaxed. And, you know, somebody knocks over your water. You're like, oh, it's no problem, whatever, right? Okay. Flip the script. Okay. You've just had a terrible day and everything is super stressful, and somebody rear-ended you and your stress level is through the roof, and somebody knocks over your water and you're like, what? You know, and you blow up at them. Right? You know, I mean, it's huge. And then it's not only just affecting you, but then you've got the ripple effect of what your attitude ends up affecting everybody else too. So, you know, it really has effects in pretty much every aspect of your life. And, you know, the more stressed you are, the higher your blood pressure is probably going to be, puts you at a higher risk of a heart attack or a stroke, you know, and so it actually plays a huge part, which most people don't think about, you know, stress management as really being something that they need to consider when they're looking at their entire disease process and what they need to do to do better and feel better.
That's so great. And I think a lot of times we're super stressed and we're so conditioned to be stressed that we don't even realize that it's present. There was this great post that I'll post like once a year, and I saw it maybe 5 years ago. And it said, stop, take a minute, breathe, relax your shoulders. It's like one of those posts. And the first time I read it, I was like, okay, stop, breathe, relax your shoulders. I was like, my shoulders were up here and I didn't even realize. So when I relaxed my shoulders, I was like, oh, I didn't even realize.
And it's like immediate relief, right? I mean, you just sit and like, just take a really good deep breath and like, slowly let it out. And I mean, you just like feel it melt off of you, right? I mean,
Yes.
it's immediate, right? And
Yes.
so doing more of that, which most people, like you said, it's there and you don't even realize it. And it's like you've constantly got it, something, muscles clenched,
Yeah.
just waiting for the pin to drop. And
Oh my goodness. So what are some practices that you recommend to your clients to help them relax, and something that kind of can instantly have that melt away effect that you were talking about?
so there are a lot of different techniques that I recommend with my clients, but guided meditations are going to be really super great ones. Aromatherapy kinds of things can be really good for you as well. Kind of going to get all those senses into the mix. I personally also use something called binaural beats, which it helps to kind of get your brain waves like on a synced and on a certain path
Is
to help
that like
everything.
frequencies? Like it's noise at a certain frequency that's supposed to, is that that type of thing?
It is, but you have to use headphones to do it, to where you're getting one frequency in one ear and one frequency in the other ear, and then
Oh,
having the two, and the difference between the two frequencies is where your brainwaves want to sit.
oh, that's very cool. So, how does aromatherapy help? I am someone who loves certain smells. Like, oh my gosh, one of my favorite things to do is just to go to a big box store and just smell candles.
Absolutely,
When I
yes, for
love
sure.
one, like I have to have it. What is it about that?
Well, so I mean, just like every other one of your senses, what you're hearing, what you're seeing, what you're feeling, smell goes into a lot of those things too. And it can help to pull back memories from like childhood, or something that something you remember from a loved one, for example. I have a mostly used bar of soap in a baggie at home because the smell of it reminds me of my grandfather. And every time I get that smell, I just get a flood of memories of, him out in the garage, piddling with whatever mechanical he was working on, or, with all the grease on his hands from working on the lawnmower or something. And just, having, pulling back all of the memories, and, feeling the love from those memories. It's very helpful and kind of uplifting to be able to pull yourself back to that stuff.
I'm having an asthma attack right on air.
Oh my, breathe in your nose. Go get your inhaler.
My producer's getting it for me right now.
Another awesome one for the aromatherapy is something like lavender, and then there's also a mixture. I would have to get it for you. I don't remember all of the ingredients in it. I build it, and it's already in like one vial for me, so I can just do it all at once. But it's a blend called Breathe, and it's helpful for dealing with sinuses and allergies and asthma, and then the lavender, I usually add both of them at night in a diffuser to kind of help, get that overnight. And then the lavender helps you sleep as well.
Oh, that's nice. I could use something that's called Breathe right now. That's it. I'm like all sweaty and
No, that's
oh,
okay. That's okay. But
oh,
another thing with my program, it's not just about all that physical stuff. Brings in that stress management. We also deal with a lot of mindset things. And, if you don't believe that things are going to change, chances are they're not going to.
yeah.
And so kind of dealing with a lot of that mindset stuff makes a huge difference. And I mean, the things that we talk about in my program, most of these things are not going to be something that you would even think about having a conversation in your doctor's office with your doctor about, you
Right.
you go in there because your high blood pressure's high, or you're having an asthma attack or something like that. And, they're there to treat that chief complaint. But there's all these other components of the person that you have to address to really, get a full picture and full treatment. And my program does that for you.
I love that. Tell the people how they can reach you.
Wonderful. So you can text Discovery to 502-208-5871 if you would like to book a call with me to talk about my program and how you can enroll in my program. You can also find me on Facebook. Send me a friend request. Aimee, Aimee, Rossini, Rossini. And you can send me a friend request. I also have a private Facebook group specifically for chronic disease management as well. And actually, next week I am doing a nutrition reset in that group. And so get a couple of pounds off a couple of days before the holidays start. And so you got a little bit of extra room for some Thanksgiving food.
Oh, I love it. This is a episode for perseverance because you showed up. I'm having asthma attacks on the We're
That's right. Absolutely.
But I'm going to keep all this in because I think it's important for people to know and see and understand that life is not perfect.
It is not.
And we have these moments that we go through. We're real human beings. What did you say is going on with you?
Yeah, no, I have pink eye.
Yeah.
Again. I don't know if you've seen the photos that I took about 2 months ago. I had viral pink eye then. I think I have bacterial pink eye now. But wow. I looked like I'd been in a bar fight 2 months ago. It was like the size of a baseball.
But this is the good stuff. This is the
right.
stuff. But guess
what?
You're still here.
That's right.
Still showed up, inspiring people, teaching people things. You guys make sure to reach out to Aimee Rossini, your wellness coach, my friends. Go ahead and hit the music. I'm going to choke through this prayer really quickly. All right. Yeah. So this is the time of our podcast where we close out each podcast with prayer to honor God for our abundance. And Aimee, I appreciate you coming to the show and sharing your time, pushing through. And I appreciate you. You guys, you make sure to text Discovery to 502-208-5871. So let's get into it. Lord God, I thank you for another day. I thank you for this opportunity to be here. I thank you for the opportunity to be able to serve and sit and partner with so many amazing, ambitious entrepreneurs that care and love and show up for other individuals in the work that they do day in and day out. I pray a hedge of protection and growth and abundance over Aimee's new business that she just launched as a wellness coach, Lord God. I thank you for the opportunity to help showcase her story. And I thank you for allowing me the platform to share your people's stories and to empower them, Lord God. I pray this according to the character and identity of Christ. Amen. Amen. All right, girl. Thank you so much for watching, everybody. Thank you to our people in Indiana and Tulsa and South Carolina. Thank you for supporting the show. You guys make sure to reach out to Aimee so that she can help you with your wellness journey. I love you guys, and I will see you all later. Bye-bye.
Bye-bye.